In an interview with the Chief Medical Director of Lagos State University Teaching Hospital, Lasuth, Biscon correspondent Jumoke Adeoti had an in-depth interview with Professor Tokunbo Fabanwo on Nigeria's response to the COVID-19 virus since the index case in the country.
Even before the index case came into Nigeria, of course, due to the fact that we didn't close the borders on time, our hospital had prepared. We had done certain things. We had ensured that there was water running in the whole hospital. We had gone into massive purchase of hand sanitizers as well as protective kits. We also purchased quite a number of thermometers, handheld thermometers, to be able to check people. We knew that sooner or later we were going to start screening people who are going to come into the hospital. So after the index case happened, we knew there was a risk that other cases would come in. So we started a triaging system for all patients coming into the hospital. They had to fill a questionnaire, and that questionnaire would ask about some COVID symptoms like cough, sore throat, loss of taste, loss of smell, chest pain, headache, diarrhea, and of course breathlessness. And then we also took their temperature, and we also did their oxygen saturation. And putting all this together, we would arrive at a verdict of whether the patient was a COVID suspect or not. If he was a COVID suspect, then we would ask that they do a COVID test.
The new UK coronavirus variant was a major part of the discussion, the second wave of COVID-19, and the attitude of Nigerians towards the non-pharmaceutical protocols of COVID-19. Professor Tokunbo Fabanwo also explained the psychology of disbelief towards the severity of the coronavirus and also gave some suggestions on ways to curb the spread of the virus.
Well, what we know first and foremost is that it was first discovered in the UK, and I think then after that in South Africa. And now I know that there's information that there's some cases in Nigeria that have been isolated in Nigeria. I'm not sure whether there's an association between this new variant and the second wave of COVID. There are two different phenomena entirely, as far as I'm concerned. But information we have is similar to both the second wave and to the new variant. And that is that there seems to be more aggressiveness in the attack of the virus this time. This time around, it looks as if the virus is more easily contacted. Two, it quickly leads to complications that will lead to death. So there's a higher mortality with this second wave, which may be due to the new variant, I don't know. Okay, but don't forget that even when you say there's a second wave, it may be as a result of certain reckless behavior during the first wave. And indeed, in Nigeria, you would agree that there was certain reckless behavior that might have led to our own second wave. Look at NSAS protests, where people just congregated together, no mask, no physical distancing.
But funny enough, the cases were low at that period.
Yes, that's what I'm saying, that during that time, we were coming towards the end of the first wave. There was a downward trend. And then that event happened. And we knew, those of us who are medical doctors and scientists, knew that with what happened, there was bound to be a second wave. And there's going to be a third wave. I'm sorry to be a prophet of doom, because even during the second wave, people are still behaving recklessly. People are not adhering to the guidelines. Events are being held by individuals, by organizations. Hoteliers and club owners secretly hold gatherings and they lock people up so that the government officials will not know that anything is happening inside their hotels and their events. It's crazy. So, and then you go to public, the public transport people, they've totally forgotten about carrying 50% number of passengers. There is going to be a third wave, whether we like it or not. I'm not a prophet of doom.